Yes. Well, we have some rain ahead of us, so in that regard, it wouldn't be seen too clearly. But we have been speaking with individuals from the Trinidad Eye Hospital and CVRS for the month of June because June is Cataract Awareness Month. So joining us this morning, again, it's Dr. Ronnie Bowler, who is the CEO and eye surgeon at CVRS and the Trinidad Eye Hospital. We also have Ms. Franca Mohammed, who is the manager stakeholder of engagement at CVRS and the Trinidad Eye Hospital. Good morning to my guests and welcome.
Morning, Carrie. Morning.
Good morning.
Yes, thank you for being with us this morning. And you know, we've had such great conversations as pertains to eye health and cataracts and you know the surgeries that are available and all. And you know, I just want to find out from you. I'll start with you, Dr. Bowler. What has been happening in Trinidad and Tobago with regard to cataract surgeries during the pandemic so far?
So what's happened with the pandemic? It's created a backlog of cases in the public sector, and I'll leave Franca to talk a little bit about that. But what we have been able to do at CVRS TH is get patients comfortable with the idea of if they have a problem with their vision, that they need to come into us for us to assess the urgency of the problem. And what we've also created almost like a COVID bubble so that people feel comfortable when they come either to the clinic. When they come in, we follow all the MOH guidelines for safety so that patients feel extremely safe within the clinic area. But also in the surgery area, it's even better because remember, when we're in a surgical environment, we have to wear all the PPE that you could think about, the masks, the gowns, everything. So I think what we've been able to do during the COVID period is determine the medical urgency of cases and only do the ones that we really think is absolutely necessary.
Right. And let's speak more on the backlog, Franca, you know, and how the Trinidad Hospital is prepared to, you know, assist with that when it comes to the public and their eye health.
Yes, Carrie, that's a very important thing that we wanted to share because, you know, with the lockdown, all of the public eye clinics have been closed. And obviously, you know, people may have been close to having surgery. They may have been signing up, you know, getting ready to go. And, you know, that could be very worrying to be sitting at home wondering, well, you have no idea when this is going to end. But luckily, as Dr. Bowler was saying, you know, the ophthalmologists in the private system have been allowed to continue within the MOH guidelines. So if you are sitting at home with eye pain or you're visually impaired, you can't carry on your regular day, you know, you can reach out, you know, and we have created options for patients to get some care, you know, especially with the restraints and the economics right now. You know, many people have reduced income. You know, we do have some programs like the subsidized program where, you know, surgery could be up to 40% off and, you know, you have payment plans. So rather than sitting there hoping, you know, for it to go away, it may actually be getting worse. So we wanted to encourage the public, you know, to access care, especially during the Cataract Awareness Month. We don't want people to think that there's no solution and they can reach out.
Definitely, yes. Especially as we learned before, cataracts are something that if you do nothing, it will progress, but it can be reversed with surgery.
Yes, exactly.
So doctor, I know you mentioned earlier that, you know, the surgeons and the medical professional will be wearing pretty much full PPE and they'll be in an environment that is controlled. But how safe, outside of just the PPE, what other safety measures are in place to ensure that, you know, not only that the clinic is safe to perform surgeries because it's a pretty much sterile environment, but also the compound on which patients would be, you know, waiting and whatnot?
Yeah, so what we have done, I wish you could come and see the clinic, Carrie. What we've done, yes, you know, the pandemic really has created not only opportunity, but need. So we were, I mean, it's very interesting because patients were, before the pandemic, we were in a really small area, maybe the size of a 20 by 20 room, and we were running a lot of our operations there. But when the pandemic hit, we realized we can't have patients crowding. That was a big issue. So what we did was we moved our San Fernando office to the Masca facility, which is 10,000 square feet of floor space. Right. So what we've done is we've created 3 large waiting areas here. So when patients come in, they are moved around in a sort of a belt fashion, so that you move from one area to the other area to the other area, and you always distance yourself from from everything. So what we've done is we created that sort of environment where you have the social distancing being done. You also have, we clean and sanitize everything almost every 10-15 minutes. Somebody's walking around sanitizing. When you come into the facility, before you even get anywhere, you're going to have your temperature checked. You're going to have somebody asking you questions as to everything about the COVID, if you have any fever, if you have any symptoms at all, and we're recording all of that. So, feel very safe as you're coming in. You're going to be in this environment where for the next half an hour or 1 hour or whatever it is, you're going to be pretty okay. The worry is we don't want you moving too much in the community. So what we advise people to do if you think you have an emergency, call before you come in, so we could triage you on the phone. We're not going to only triage your problem, but if you need to come in, we're going to triage to see if you're well enough to come in and you don't have any symptoms of COVID. So what happens there is we really cut out the risk as much as possible for the transmission.
And that is key in this time of a pandemic, of course. And Franco, over to you. How can people access this service? And you mentioned earlier about having cost subsidized and all like that, but let's speak actual figures afterward.
Yes. So we have a phone number 235-4835, and we are located in San Fernando, Maraval, and St. Augustine. So there's a lot of access. But similarly, as I mentioned before, apart from having the subsidized price option, a cataract surgery is really between $12,000 and $14,000. So 40% off of that with payment plans is what we have introduced for people to access. And there's some people who can access, who have no funds, and they still have urgent need. So we do charity events, and we have one coming up on July 26th, and we have another one in December. So people who can't afford anything at all, we have accommodations for them. And something we also did was we reached out to the the regional health authorities, to offer any kind of assistance, because we understand that their patients may be worried and waiting. And if there are urgent cases there, we welcome them to come and get their surgeries done on our charity list, because we understand, it's going to take public and private working together to help alleviate those needs among the community within the area of the health sector. And this is what we want to do with eye care in the situation that we're currently in.
Surely.
Yeah.
And just some quick medical questions, Doctor. I know we would have gone through a number of the things, but there are different people watch the show on different days, and you never know what information might be helpful. So when it comes to, let's say, for cataract itself, if you are, what is it that someone would experience, symptoms and signs that they may need to see? They may need to come to the Trinidad Hospital.
Sure. So cataracts really present with a reduction in your vision. So you start to notice some of the things that you're accustomed doing, such as reading, driving, start to become a little bit more difficult. You're just not seeing those things that you were seeing before to read them clearly.
Right.
And that's the main symptom people get. People also get some glare. They're driving at night and the lights all of a sudden have streaks on them and they're a little bit bright. So that's the kind of major issues they start to get with their vision, and they have difficulty functioning like they used to. So it kind of varies to with age. So the younger person who working really needs to see close to 20/20. So we might do their cataracts a little bit earlier. than the older person who's at home, have to cook and clean and that sort of thing. Maybe they will, keep it for a little bit longer. Doesn't really matter. It really depends on your need, and then we decide when, depending on, how you're suffering.
Definitely, definitely. Well, Doc and Ms. Mohammed, that's all the time we have for this morning. I want to thank you both for joining us and giving us more information again as we continue the conversations during the month of cataract awareness, the month of June. And I want to thank you for your time and again for the charitable work that you have been doing and the way in which that you're helping the public. Congratulations, and we really commend you on the great work that you continue to do.
Thank you, Gary.
Thanks so much. It's a pleasure.
Nice to be here.
Yes, continue to stay safe, and I guess we'll speak again soon, maybe next week.
Yes. All right, Gary.
All right,
Take
have
care.
a good one. That's Dr. Ronnie Bowler, CEO and eye surgeon at the CVRS and Trinidad Eye Hospital. We also had Ms. Franca Mohammed, who is the manager stakeholder of engagement at CVRS and Trinidad Eye Hospital as well. And we were speaking on, Cataract Awareness Month and what you can do to maybe seek some emergency service. We are going to take a short break and come back with much more here on the Now Morning Show. Stay with us. We'll be right back.